Good day. John Dombrowski here. I'm the current president of the DC Maryland Society of Addiction Medicine. I want to take this opportunity to bring the membership up to date of what's been going on with your society. Just this past Wednesday, we had a board meeting with the board members in terms of what's going on, and I wanted to bring you, the membership, up to what is the latest with the society. First off, there is an annual meeting of the American Society of Addiction Medicine. It's the 53rd annual conference. It is in Florida. It is March 31st through April 3rd. Please check the website, and I hope to see everyone there. If you can make all of it, that's great. But if you can just make a portion of it, it is excellent, not only in terms of a fellowship explaining ideas or exchanging ideas, but it's also a great educational opportunity and great CME. So I want to make sure that you guys are aware of that. Usually we do a meeting down there. This year that won't be available because they didn't provide us any space for meetings, but I'm sure we'll meet on our own. Other things I want to bring your attention to is the Opiate Coalition. Basically, with the opiate problem that we've had in the United States, there's been a lot of monies that's been paid out from the pharmaceutical industry, distributors, etc. The state of Maryland is most likely going to receive over $500 million to care for our patients. Now, this Opiate Coalition is actually reaching out to your society in terms of, well, getting ideas. What do we do with this money? Where should it be spent? And since we're on the front line, I think we're going to know the best way to move that money directly to patients so they get the right kind of care. A couple ideas that were shared with during the conference, during our conference call, was this. First off, workforce pipeline, making sure there are plenty of physicians skilled, as you are, in terms of addiction medicine. Now, certainly this does take time. The other aspect is counselors. There might be plenty of physicians, might be plenty of nurses, but there are not enough counselors, and that is really can limit the number of treatment patients in treatment centers, such as methadone clinic. There you can only do one counselor for 50 patients. If there's more patients there and they only have one or two counselors, well, then they're limited. 1 to 50 is the ratio. So we need to look at trying to get more access to these counselors, maybe that's school, funding, etc. Another thing that we're looking at is youth prevention. And this could be, education of, in high schools or college settings, but most people know about that. But the other thing that was interesting is children or young adults who are getting procedures such as maybe a hernia repair, a knee scope, and certainly dental procedures. So maybe we as a society can do something more about educating general surgeons and perhaps orthopedic surgeons as well as dentists. Now, as you are aware, I'm an anesthesiologist, so the American Society of Anesthesiologists have really taken a significant view at this, and we've done a lot with respect to preemptive analgesia, so we do not dispense as many opiates as we would have otherwise. So I think we're on the right track, but if we can do more as a society, I think that's great. Other aspects are, recovery programs, making sure that we have access to these recovery programs. Another idea was pre-authorizations. A lot of times, your time might be spent trying to get pre-authorizations for medication management. So in other words, whether it's Suboxone management or intramuscular therapy of Vivitrol or Sublocade or something like that, this takes time and takes money. So wouldn't it be great if somehow we could, if you've diagnosed the patient with the correct diagnoses, so instead of waiting, we'll come back in a week or two when you get your approval, you can care for them right away, because sometimes they don't make it back. So it'd be great if we had that ability to make sure these patients could be seen immediately. We can provide them medication immediately to start their sobriety. Other things that we're looking at is hepatitis C, treatment and prevention. Other things that we're looking at are things that might be barriers to there's patient sobriety coming into clinic settings, such as childcare, perhaps transportation issues. So you can see there's a whole host of options that we can use this $500 million for. And hopefully, if you have any ideas, please let me know or let the staff at Ms. Carissa Miller know, and we'll be sure to forward that along. Other thing I want to let everyone know is that we had a great turnout with respect to these videos. Really, normally there's not much response. It's about 4% response. For whatever reason, this was a 34% response. So that's just great news, and I really appreciate that. With respect to public policy, Dr. Joe Adams has been meeting with weekly on Tuesdays in terms of what's going on in Annapolis. Big thing that's really of interest would be the decriminalization of marijuana up to 4 ounces, and that's really the biggest challenge that we have right now. There's nothing else on the horizon that we see. Our finances look good. We actually are a little ahead of schedule, which is always positive. And one thing that we want to do with this is maybe have another educational meeting. We do have one educational meeting that we needed to reschedule due to the speaker, but hopefully we're looking to do this in April or May. And this will be in person, which I think is really important. Again, do we get connected to know one another, talk about our practices, talk about our patients to kind of move the ball forward. And you'll be hearing more about that. It's going to be April or May, but you'll hear about it fairly quickly. And also being that we do have this extra money, perhaps, is to do another educational program. Again, one of the real aspects of any society is membership, engagement, and education. Obviously, you have to spend money to make money. So if we want to do that, please let us know and get our other members involved. Other things that we have, again, the membership looks good. If you have friends who have dropped off their membership, please reach out to them and say, get to be a member. We're getting revitalized, which I think is very important. And any opportunity that you think of somebody who should be a member, whether a nurse, a PA, a med student, a resident, a pharmacist, a therapist. Again, the American Society of Addiction Medicine really encompasses everyone involved in that patient's care, which is so incredibly important. And lastly, I will leave you with the aspect of leadership. If you have yourself, or perhaps a friend or a colleague who wants to be involved in leadership, please let us know. We'll get them started, and that way they'll understand what organized medicine is, and they can be a real part of it, which is important. The membership and our society is only as strong as you are, and we hope that you will take advantage of the membership. I want to thank you for your time. Enjoy.